So in this video, I'm going to be talking about magnesium, what it is, how much you need, what are the best magnesium supplements to take, what increases your need for magnesium, etc. Magnesium is an essential nutrient. It's an essential mineral. We get it from our diet, but we can also get it through supplementation. Now, about half of the population is not consuming the recommended amount for magnesium, which for men is somewhere between 400 and 420 milligrams per day. And for adult women, somewhere between 310, and if you're more around like the 18-year-old age, higher, like 350, 360 milligrams. But that recommended daily allowance doesn't necessarily mean an optimal amount. It's highly individual magnesium, how much people need, and I'm going to go into why certain people need more magnesium. So one of the main problems why magnesium deficiency is so prevalent, I'll kind of go into like the prevalence of that, is because the way we grow our food is completely different than the food we used to eat 100 years ago. So just from about 50 to 100 years ago, on average, the magnesium content of vegetables has gone down from somewhere between 25 and 35%. In animal foods has gone down somewhere between 10, and in dairy products as high as 70% reductions in magnesium. So things like cheeses have lost the most magnesium, somewhere between 40 and 70%. Animal foods, red meat, anywhere from about 10 to 20% reductions in magnesium compared to just 50 years ago. So that's one reason. Even the content of magnesium in wheat has gone down by 20-30%. And partly this is because we now just grow crops for yield. So we grow crops very quickly. They have less time to extract the nutrients and the magnesium, but also because we use fertilizers, which reduce the uptake of the minerals, heavy metals also, and the acidity of the soil also reduces the uptake of minerals. So our food has less magnesium than previously. Now, estimates from Paleolithic studies, which aren't 100% accurate, sort of indicate that we probably consume somewhere around 500 to 600 milligrams of magnesium per day. The average person is now probably consuming somewhere between 200 and 250 milligrams. So we're consuming about half the amount of magnesium that we essentially evolved on. And so that's partly the problem. Now, there's many things that can cause magnesium deficiency. There's over 60 factors that cause magnesium deficiency. So that would include things like elevated blood glucose, elevated insulin levels, which high insulin will kick magnesium out in the urine. So you'll spill magnesium out in the urine. Insulin resistance will prevent magnesium from getting into the cell, basically, so you can't utilize magnesium as well. So really, type 2 diabetes, elevated blood glucose is one of the main contributors to magnesium deficiency. But also now our food supply is decreased, has a decreased magnesium content as well. Exercise will increase your need for magnesium, not just from the fact that we lose some through sweat and an increased production or an increased loss in urine too when we exercise, but simply the need for magnesium to activate enzymes. So magnesium is required for about 800 enzymatic reactions in the body. So it's this cofactor for all these enzymes to work. So magnesium helps to create ATP, which is energy in the cell. It helps to activate ATP. So essentially magnesium has to bind to ATP for the ATP molecule to lose its terminal phosphate to then release energy. So to activate energy in the body, you literally need magnesium. Magnesium also activates vitamin D. So the enzymes in the liver and the kidney require magnesium to convert the vitamin D that our skin produces into the active hormone called calcitriol. So if you want vitamin D to work, you need to have good magnesium status. Magnesium is also needed to synthesize something called inositol in the body, which helps with sleep and hormone function and insulin sensitivity. So insulin won't work without inositol. Essentially, when insulin binds to its receptor, it releases inositol compounds, and that's how insulin works. So if you want the cell to absorb glucose well, you need to have good inositol, and the enzyme that makes inositol in the body requires magnesium. So magnesium is also required to form numerous neurotransmitters in the brain. If you want to form dopamine, if you want to form norepinephrine, so feel-good hormones, if you want to be able to sleep at night, you want to form melatonin, you literally need magnesium in the brain to do that. So magnesium is also important from the fact of keeping blood pressure low, dilating the arteries, reducing calcifications of the arteries, having a normal heart rate. So people, let's go over some symptoms of magnesium deficiency. Arrhythmias, coronary artery calcification, heart failure, depression, irritability. Those are some of the more severe. Heart disease, even sudden cardiac death. People who have died from heart disease have lower levels of magnesium in their heart. So magnesium is important for heart health. Ringing in the ears can be due to magnesium. Hearing loss can be due to magnesium. Photosensitivity, migraines, headaches, muscle spasms, muscle cramps can all be contributed by magnesium deficiency. Altered gait, decreased cognition. So magnesium is something that there's subclinical magnesium deficiency where you can't see the symptoms, right? You can't see if your coronary arteries are calcifying, but you can. It also develops what's called frank deficiency, and those are all the symptoms I just covered that you can kind of see, and those are clinical symptoms that are like measurable. So what is an optimal intake of magnesium? Well, I said that most people are consuming around 250 milligrams of magnesium. Now, the minimal amount to just not continually lose magnesium from the body ranges really, there's a huge range, and it obviously depends on the person, but some people only need 150 milligrams to not continuously lose magnesium, so to remain in balance. Now, that's not optimal. That's just remaining in balance. Some people, if they're on a high fiber diet, need 400 milligrams of magnesium just to remain in balance, because fiber binds magnesium and you poop a lot of the magnesium out when you are consuming high fiber foods. And also very high amounts of fat will bind magnesium as well and form magnesium soaps, and you will reduce the absorption of magnesium. So you always want to space magnesium out from very high fat or high fiber foods to improve its bioavailability. So I cover the range between 150 to 400 milligrams just to remain in balance. So what is a more optimal intake? Well, on a high fiber diet, and a more optimal intake of magnesium is probably somewhere around 600 milligrams, or maybe even 700. Whereas on a lower fiber diet, somewhere around 400 to 500 milligrams is probably more of an optimal range. Now, some people with high blood pressure actually need upwards of, there's been studies that have given 600 milligrams of magnesium 3 times a day to help control blood pressure. So people that are sick may need more magnesium. So which magnesium supplements are good? Well, it depends on basically what symptoms need to be improved. So magnesium citrate is really good for constipation in people who are constipated. It's really good for kidney stones because the citrate helps provide alkalinity, which helps reduce kidney stone formation. So that's a good magnesium for those two issues. But really the ultimate goal is to have a very high bioavailable magnesium, which two good ones are magnesium malate, which actually is the best for improving muscle magnesium content, and magnesium glycinate. Okay, both of those are very highly bioavailable. Magnesium glycinate seems to work for sleep really well too. Magnesium malate seems to work for increasing energy, increasing muscle function, reducing muscle fatigue, things like that. And then to increase magnesium in the brain, the best ones are magnesium L-threonate and magnesium, what's called acetyltaurate, or some products will just call it acetyltaurate. And essentially those two are the magnesiums that have been clinically shown to increase magnesium in the brain. So things for cognition, for people that are trying to improve mental acuity, magnesium threonate and magnesium acetyltaurate or acetyltaurate seem to be the best. And it's the acetyl part that increases the bioavailability of magnesium in the brain. There are many tests to basically see if someone is magnesium deficient, but you need at least 2 quality tests to really ascertain if someone has magnesium deficiency. But when we look at the general population, even young athletes, over 40% of them have been shown to have magnesium deficiency based on retention from an oral magnesium load, which is better than just blood tests. If you use a better range, then blood can work. So typically, doctors will only diagnose magnesium deficiency if the blood level is less than 1.7 milligrams per deciliter. But really anything less than 2 milligrams per deciliter is suggestive of magnesium deficiency, especially if 24-hour magnesium in the urine is low. And certainly if the IV magnesium load magnesium test is showing a lot of retention. So if the body's trying to hold on to an IV load of magnesium, that typically indicates that it is deficient in magnesium. It's trying to retain all that it's been given, versus in someone who's very replete, they will only retain like 8% of a magnesium load, whereas someone who's deficient will retain 20% or more of an IV magnesium load of about 400 milligrams of magnesium, which is given IV over about 4 hours. And then you see how much comes out in the urine over 16 to 24 hours. That's the gold standard test for magnesium deficiency. And the best blood test that actually has been shown to sort of match IV magnesium load is what's called mononuclear blood cell magnesium. So that test is the best blood test to indicate if the whole body is deficient. But it's hard to get a doctor to order that, and it's hard to even find a lab that can do that. Now, the other factors that cause magnesium deficiency, besides we talked about elevated blood sugar, we talked about our food supply being lower in magnesium, is exercise. We covered. Coffee isn't as big of a magnesium depleter as people think it is. It does increase some loss out in the stool. It does increase some loss in the urine, but it's not a ton, maybe about 20 milligrams extra a day you need if you drink coffee. So that's not that big of a depleter. Eating a very high acid load diet without consuming some type of bicarbonate or citrate, either from fruits, vegetables, bicarbonate waters, having a high acid load from the diet can start stripping the bone of magnesium. So that can increase magnesium need as well. And then numerous disease states, medications like diuretics will increase the need for magnesium. So magnesium is a missing mineral in our diet. And it is something that I've seen with my patients that basically if they start taking magnesium, a lot of their symptoms start improving.